Dear friends, I am Dr. Rajat Agrawal. A pediatrician is a person who serves as a conduit between a child and the parents in caregiving. If there are certain difficulties by the parents, faced by the parents, like regarding the feeding or the illnesses, then the pediatrician is here to help. The pediatrician, we would look after the overall growth, overall health monitoring, overall illnesses, overall vaccination of the child, and would guide you appropriately what is to be done and what is to be avoided. The major causes of dehydration in a child, they are repeated diarrheas and the vomiting. The diarrheas, whenever they occur, then the best form of therapy is oral rehydration therapy, which is done with the help of ORS, which is easily available over the counter. It is to be mixed in the water and is to be given after every stool. If there is persistent vomiting, then you should approach to the nearest health facility, and if the ORS is itself not able to help, then you should consult your doctor immediately. There is a sudden spurt in the cases of social and the behavior problems in the child. These are mainly due to the parental pressures and due to the peer pressure faced by the child. There are certain cases of bullying which are occurring in the schools, and the child is having that inside him, which pent up the feelings, and the child shows the negativity towards the parents and have some behavior issues. The best way is to talk it out and to give adequate counseling to the child, and to talk to the child in alone or take the help of a pediatrician or a counselor. Feeding is very important in a newborn and an infant. It is a milestone for the growth of the child. If the feeding is faulty, then the child is not able to achieve the required milestone. So the first thing and the foremost is exclusive breastfeeding, which is to be taking place in the child newborn till the age of 6 months. The breastfeeding should be exclusive. There should be no external water, milk, honey or kutti. And after 6 months, the child needs some above nutrition, which is called weaning. The process of weaning is a very crucial one, and it helps the mother in gaining the confidence, so a proper counseling for the weaning episodes is to be done. Faulting feeding is also called, whether we introduce certain cereals before the age of 6 months, and it can lead to certain illnesses in a child. With the approach of rainy seasons, we see a lot of dengue cases in Delhi. So dengue, it is a form of vector-borne disease in which a mosquito bites and the fever occurs after a certain time. The fever itself is a dangerous type if it is associated with certain rash on the body. So a healthcare opinion should be taken. If the child develops fever with rash, or there are certain danger signs like vomiting or retching or pain abdomen, then a blood monitoring, blood platelet test are tested. Oral rehydration is very important in cases of dengue. So ORS or certain plenty of fluids are to be given. Dengue is majorly about its prevention. So we should consider more focus on the prevention of the dengue rather than the cure, because in prevention we can cut down the disease. For it, the best thing is to wear the full clothing, the full sleeves shirts and the trousers and the boots. Other using mosquito repellent, mosquito nets, then there are certain mosquito patches, but the best thing is to prevent the breeding sites of the mosquito. So we should look for the artificial collection of the fluids in the tires, open containers or the gamlas, and we should put the kerosene if there is a collection of water, which will die down all the larvae and the eggs, and the mosquitoes will not replicate in it. A parent should look after the child and should not be over aggressive in anything. The feeding, there are certain guidelines for the feeding, like exclusive breastfeeding is to be done. Early introduction of cereals is detrimental to the health. So the weaning, it should take place at the 6 months. A parent should identify the danger signs in a newborn or in a child. What requires the healthcare attention? The child should be monitored for dehydration. Proper nutrition is to be given. Proper vaccination is to be given to the child. Adequate health and growth monitoring is to be done. If there are certain doubts, or if you are doing something wrong or which you don't understand, then contact your nearest pediatrician or your general practitioner to get all the information.